Well, what we have here is a new device called EsoCheck. It's a device that can actually get cells from your esophagus without having to do a procedure and then analyze them for the presence of Barrett's. Barrett's esophagus is a change that puts people at risk of developing something called esophageal adenocarcinoma. That's mainly due to changes brought on from chronic reflux disease. The problem with current screening is that we only screen people who are known to have GERD. But the problem is most people either have mild GERD or what we call silent GERD and don't know that they have the Barrett's esophagus. So we're not finding as many people as we should to try to prevent that cancer from happening. This device allows us to do the screening without having to do an endoscopy and then capture more people so that we actually get them in the right program for screening and decrease the rate of esophageal adenocarcinoma.
It's just a good non-invasive way, meaning non-endoscopic way of screening. There's a lot of factors wherein patients could not get into an upper endoscopy, and this could be a simple solution to that.
It also allows for people to have an initial screening episode without having to get sedated or take a day off from work or get somebody to drive them home. So it really facilitates finding something before the cancer develops and then gets them into an endoscopic screening program that would allow us to treat it before cancer develops.
This just opens up opportunities for everyone to get screened if they really need to.
The individual swallows this with some water. The device that you swallow is about the size of a 1,000 milligram vitamin C tablet, to give you a sense of perspective. It goes down as you're drinking, as the esophagus pushes it down into your stomach. Then once it's in your stomach, and you know that by the measurements here, then the balloon gets inflated and gets pulled through the esophagus. In these rigid areas here, it collects the cells. But to keep from losing them, once you get up to a certain point, you can then withdraw the balloon, collecting the cells inside, protecting them, and then have this come out of the mouth. This gets cut off and sent for analysis. What the cells you have there then get sampled for certain types of tumor markers that are known to be associated with Barrett's esophagus. And then if you were to have some that were positive, then you would have endoscopy to see how much Barrett you had, whether there was ongoing inflammation, whether, God forbid, there was a mass or something else. But then you would be in a screening program. Had this not occurred and you don't have reflux, we don't know you ever have it.
This is a very safe and easy procedure. That's an alternative for an invasive procedure, endoscopic procedure. I think anybody can easily try this out and get an answer right there and then. Like, do you have Barrett's, or would you need surveillance for Barrett's, or you would not? So screening is very important. You know, preventing it to become cancer is the key here. Because when it's cancer, it might not be curable anymore. We catch it early, we can treat you and cure you.